Hi, I'm Dr. Tanveer Janjua. I'm a board-certified facial plastic surgeon. Today I will be demonstrating a scar excision on the left cheek of an individual who received a scar from a sandfly infection on the cheek when he was very young. For the last 15 years, he has been going to different plastic surgeons trying to figure out what kind of scar excision or scar revision he wants to undergo. So we had a very lengthy discussion and we went over many different possibilities. The scar is located on the left cheek. It's quite an extensive scar and it's atrophic, meaning it's depressed. So the options included doing an excision with a rhomboid flap, doing excision and then doing a V to Y advancement in one area, and many other possibilities. And finally, the patient and I discussed and we both felt that doing a straight elliptical excision parallel to the nasolabial fold, incorporating the nasolabial fold, would be the best option. And as you will see when we start the marking process, there's more skin boundary on the lateral aspect and less on the medial. So the difference between the two sides means we will have to use the halving principle. It means you stitch the center of this side to center of this side. You still have more on each side. Then you use the center from here to here, center from here to here, and eventually the difference between the length is distributed over the whole length with exact centers, and it does not bunch up as it would if you started stitching from one side and went upwards. So that's what we'll do, and it will certainly make one side of the face tighter than the other. But in the long run it settles down pretty well and does not become an issue. And later on we might use some mild laser resurfacing for the scar if it does not look very aesthetically pleasing. So let's get started. So as you can see, we have done the marking already, and this is a very challenging scar, and our patient has gone through these discussions with many of the plastic surgeons over time, and the options included excising this area only, which is a depressed scar, and then using a rhomboid flap from the lateral aspect, or doing an elliptical excision upwards and then doing just a W-shaped closure on the top, or doing serial excisions or a geometric broken line excision. But after many discussions we realized probably the best would be the simplest approach of making it fall into the nasolabial groove. And the markings are critical where we do not take too much of the skin and we are just barely touching the boundaries of the scar itself. It's also important to have the patient smile and see how it fits into the smile profile. Could you please give us a smile? So you can see that it falls into it very nicely, and I'm making a point to make sure that this falls right in the depression of the superior part of the nasolabial groove. And in the beginning we'll have some tightness in the cheek, and we will have a little pull on the lip as well. So it's going to look a little crooked, but with time it starts settling down very nicely as the skin does stretch back a little bit. So that's our plan for today. At this point we have completed our excision. The scar has been completely removed, and you can see that the nasolabial fold area looks very normal, or as close to normal as you can expect. And as it continues to heal, it should fall into the normal fold and be very symmetric with the left side. So we are following up with our patient at 1 month mark. As you can see, the area of excision has healed very well. It's fallen directly into the left nasolabial groove, and it continues to blend in nicely. There's some brown discoloration which is very common in post-inflammatory hyperpigmentation that happens in brown skin, and it usually goes away with time, and if not, you can always use a bleaching agent or IPL machine to get rid of it. At this point the goal is to minimize the scar's appearance by causing it to blend with the surrounding skin. You can use dermabrasion or lasers. I have chosen to use laser, and the laser I've used is going to be Resurfax. Resurfax is non-ablative, so there's no peeling or none of that stuff, and it still causes enough regeneration of collagen in the scar and the surrounding tissue that it blends it together very nicely, and that is our goal. And we will repeat that in 1 month. and my guess is probably 3 sessions at the most, and this should give you enough of a result that we won't need to do any more laser. And I'm going to ask the patient to smile at this time so we can see where the scar falls when the patient smiles. So you can see he's very happy, and it just looks like an exaggerated nasolabial groove on that side, which is aesthetically very pleasing, because even with normal people, sometimes one side has a stronger nasolabial groove than others, so it falls within the norm, and it'll only continue to get better. The biggest concern usually at this time is sun exposure, and the patient has to be very careful about sun exposure, which my patient is. So we'll continue to follow. Thank you. We are following our patient after excision of a large scar from the left cheek, and we are at 2 months interval, and we have done 1 session of the laser using resurfax as well. And as you can see, the scar continues to diminish, and it is falling exactly into the nasolabial groove, and that was our goal. And there's no distortion of the lips or the oral commissures, and that is excellent. And I'm going to ask the patient to please smile so we can see the change. Well, you can tell he's very happy. So you can see that as it continues to heal, the only reason we can see a little bit of scar is because of the erythema. Erythema takes a very long time, so that will eventually go away, and that's not a concern. The goal is to just minimize any hypertrophy or atrophy, and that's where a fractional laser such as resurfax works very well. And once we are done with that issue, then at some point, if erythema, the redness persists, then we can use IPL, or we can use a vascular beam laser to control that redness. But right now we are on track. We are following our patient with a very complicated left cheek scar excision. It has been 1 year and 2 months, and we have done re-excision of one area that widened, and not open, but it widened again a little bit with some mild hypertrophy. And for that we have done the resurfax 2 times, and today we'll do the last time resurfax, which is fractional laser, no downtime, and then we'll just sit down and wait and see how much improvement we get over the next year on its own. And I think we're pretty close to the point of maximum improvement that we could have achieved, and it's looking really good compared to where we started. And I'm going to have the patient smile now so we can see how it folds and how it settles down into the nasolabial groove. So there we go. You can see that it really blends in nicely, and it is not conspicuous. When you look at the old photographs, you will be able to tell. So this is a very nice result. Very happy with it. Thank you for watching the video. I hope you liked it. I love doing these videos, and I really enjoy the participation and the comments and everything from everyone, and I will keep putting in more material. And if you like it, please subscribe to our YouTube channel so you can keep watching the new editions as they come along. And also we are active on social media, so please like us on Facebook and on Instagram, and follow us on Twitter. We will try to provide excellent stuff and keep you all engaged and exciting. Thank you very much for your time, and enjoy.